PickUp is a disposable device for bone marrow biopsy. The device is equipped with an atraumatic AISI 304 stainless steel cannula with fish mouth sharpening, a lure lock for syringe attachment, and an external catching device. The needle also has centimeter markings on the cannula surface to measure the depth of insertion. Additionally, the device is supplied with a measuring wire, a lure lock cap, and a needle tip protector. Insert the needle and advance it forward until you feel a noticeable resistance that indicates that you have reached the bone tissue. Insert the needle into the iliac crest according to surgical procedures. Apply constant pressure using clockwise and counterclockwise motions. Once the needle tip is positioned in the marrow cavity, remove the stylet by rotating the upper section of the handle 90 degrees and pulling straight out. If required, attach a syringe for aspiration using the lure lock connection on the device. Insert the additional cap on the needle handle to get more grip and avoid further leakage of blood from the lure lock connector. Push the needle further into the bone marrow cavity by performing clockwise and counterclockwise movements to cut the biopsy sample. Unscrew the cap from the top of the device and use the measuring wire to determine the length of the sample. The measuring wire has 4 marks. The first mark indicates 0 millimeters of sample length. The second mark, 10 millimeters of sample. The third mark, 20 millimeters of sample. And the fourth mark, 30 millimeters of sample. Once you have checked the length of the specimen, remove the extraction wire from the cannula. If you are not satisfied with the length of the sample, push the device further in. Once the desired length has been reached, insert the catching device into the lure connector. Push the catching device all the way in. This will activate the catching mechanism, and the sample will be trapped into the catching device. Rotate the needle 360 degrees multiple times in both directions. Remove the needle from the bone by alternating clockwise and counterclockwise movements and treat the wound. Remove the catching system by pulling the plastic component. Using the measuring wire, push the specimen out of the catching system. If some of the sample remains within the cannula, use the measuring wire to enter the cannula from the tip and push the sample out of the handle.